Mr. President, as you know, I've come to the floor week after this bill has been signed into law with a doctor's second opinion based on my near quarter-century practicing medicine in Wyoming, taking care of families there. And I go home every weekend and talk to people. And people of Wyoming remember when the President of the United States spoke to a joint session of Congress. And he told the American people about the plan that was later signed into law. And during that speech, the President said, if you are among the hundreds of millions of Americans who already have health insurance through your job, or Medicare, or Medicaid, or the VA, he said nothing in this plan will require you or your employer to change the coverage or the doctor you have. He said, let me repeat, nothing in our plan requires you to change what you have. I think I just heard the chairman of the Finance Committee say, if you like your plan, you can pretty much keep it. That's not what the President said. Pretty much keep it? With the President's words and congressional Democrats, they made a vow to 170 million people who get health coverage through their employer. The President and congressional Democrats promised that if you liked what you had, then the health care law would let you keep it. What a difference a year makes. On June 14th of this year, the Obama administration released, Mr. President, a 121-page grandfathered health plan rule. And it's a rule that clearly violates the President's promise. Now, let me explain how. Obamacare included a provision allowing existing insurance plans to be grandfathered under the new law. Theoretically, that means that employers and individuals would not have to give up the coverage that they have and that they like just to comply with onerous government rules and mandates. So you have to make sure, though, that you read the fine print. Look at the chart. A chart in the new administration rules estimates that between 39% and 69% of businesses will lose their grandfathered health plan status. Now, the picture is even worse for small businesses in America, and it is small businesses that are the engines that drive this economy. The same chart in this report estimates that by the year 2013, up to 80% of small businesses will lose their grandfathered status. This means that American businesses will not be able to keep their current insurance plans. That's what this means. They will be required by the federal government to comply with all the new mandates, which are very expensive and are contained in the new health care law. This only serves to drive employer health care costs up, making it even more difficult for them to offer health insurance to their workers. Mr. President, I'm sorry, maybe the American people are confused. The American people believe that the goal of reform was to lower health care costs. America's small businesses struggle each and every day to find a way to provide health insurance to their employees. The government should be making it easier for businesses to keep providing the coverage. Instead, the bureaucratic regulation drives prices up. This is going to increase the odds that employers are going to simply choose to stop offering health care insurance coverage completely. Now, additionally, Mr. President, this so-called grandfather regulation, well, it makes it much harder for employers to make health insurance changes, and those are changes that would actually help to keep down the cost of care, to keep down the cost of coverage. Today, businesses have very few options if they want to keep costs in check and also keep their grandfathered status. Businesses that lose their grandfather status are then forced to comply with all the new rules, all the mandates in the health care law, and now, even by the White House's own admission, we're talking about up to 80% of the small businesses in this country. Well, subjecting employers to these mandates forces them to change and to expand their insurance plans. What's that mean? Well, it means the costs are going to go up. No surprise. Mr. President, it is obvious that this administration really doesn't want the American people to be able to keep what they have if they like it. The law wasn't written that way, and certainly the regulations were written in a way that violates, and this is the White House regulations were written in a way that violates the pledge that the President made to the American people. President Obama and congressional Democrats certainly like using their talking point, but the American people know it is just spin. And that's why this bill was unpopular when it was signed into law, and now 6 months later, it is even more unpopular, with 61% of the American people wanting this bill and this law repealed and replaced. And that's why I come to the floor today, Mr. President, to support the efforts of my friend, the senior senator from Wyoming. Senator Enzi, the ranking member of the Health, Education, Labor, and Pensions Committee, has introduced Senate Joint Resolution 39, a resolution of disapproval that would overturn the administration's so-called grandfather rule. It's an honor to stand with Senator Enzi and fight against this job-killing Washington mandate. So I appreciate his leadership, but more importantly, his dedication to make sure that the President keeps his promise. A promise that if you like the health insurance plan you had before the new health law was passed, then you can actually keep it. That is my second opinion, Mr. President. That is why we need to repeal and replace this health care law. Thank you, Mr. President. I yield the floor.